federally funded study shocked the medical community last year when it found that 10% of American teenage boys are currently taking medication for attention deficit hyperactivity disorder. The study by the Centers for Disease Control found that by high school, 19% of boys have been diagnosed with ADHD, while 10% of girls have been diagnosed. That's led sales of ADHD-related medication like Ritalin and Adderall to double since 2007. In response, one doctor said he was floored, calling the numbers, quote, astronomical. While researchers are still uncertain over the rise in ADHD diagnoses, there is growing concern that treatment is too focused on medication. Here to discuss that is Portland Helmich, who follows alternative medicine. So one of the criticisms of ADHD as a diagnosis is that some clinicians feel it's too broad, and that said, what can you tell us about what ADHD is?
Well, it's a learning disability, but it's also a self-regulation disorder. It's difficulty in regulating your attention, difficulty regulating your actions, even your emotions. So some people have inattention and disorganization. Other people have hyperactivity and impulsivity. And some people have a combination of both. And earlier today, we talked to Dr. Edward Hallowell, a clinical psychiatrist, and this is how he described it.
Having ADHD is a mixed bag. It's like you've got a very powerful brain, a Ferrari engine for a brain. Powerful, imaginative, creative, dynamic. But the problem is you have bicycle brakes. So it's very hard to control the power of your mind. It goes all over the place.
Some people say that it's like having a sleepy prefrontal cortex. That's the part of the brain that's responsible for executive functions like time management, task management, organization, planning. So people with ADHD just have a weaker part of that brain.
Medication is considered an effective treatment, but there's concern that if it's overused, that's bad. What alternatives are there?
One that's being looked at very seriously is mindfulness training. And mindfulness is basically paying attention to where your attention is moment to moment. It's present moment awareness. And a lot of people associate mindfulness training with sitting meditation, which is one type of mindfulness, paying attention to the breath. And again, earlier today we talked to Dr. Edward Hallowell, and he gave us his description of meditation.
Meditation. It's simple. There's nothing mysterious about it. You sit in a chair, close your eyes, and in a quiet place, and just watch your thoughts flow by. It's hard to do because you don't want to evaluate your thoughts, just watch them.
And what I would add to that is when you're practicing sitting meditation, you might be focusing on the air coming in and out of your nostrils, or you might be focusing on the rise and fall of your abdomen. And when your attention begins to wander away and you start thinking about what you're going to have for dinner or what you want to do tomorrow, you just gently label it thinking and then bring your attention back to the breath. And you might do that 100 times in 5 minutes. As he said, it's simple, but it's not easy.
I was going to say, to me, that sounds easier than it would be.
I've done it, and it's really complicated, but it's amazing how it actually sort of trains you to sort of be here right now.
ADHD is considered a chronic condition. So in that context, what does meditation do?
It's fascinating because it can actually restructure the brain. There's a new concept in neuroscience, relatively new, and it's called neuroplasticity. And it's the idea that throughout our lifespan, our brains can actually change in response to a repeated stimulus. You know, people used to think, oh, our brains are we're born with this sort of certain set of unalterable cognitive abilities and we're set for life. But no, actually, we can, just like a muscle, we can engage our brains and strengthen them throughout the lifespan.
Do you have some ideas about the rise in diagnoses for ADHD?
The rise? Well, I mean, I think right now, I think it's 1 in 10
yes.
are diagnosed as far as children. 5% of adults are diagnosed. I mean, part of it might be that we're living in an ADHD culture, right?
iPhones.
I mean, we're texting and eating, and we're on the computer and eating, and we're driving and eating, and we have 5 different screens open up. I mean, we live in a culture that's not about doing one thing at a time.
Portland Helmich, thanks for joining us. Interesting and important.
Thanks.
If you'd like to learn more about ADHD and the latest research, we've posted links to the National Institute of Mental Health. Just visit WGBHnews.org.